Good evening all. Today the class is about MI, which is Myocardial infarction and Ischemia. Okay. What is meant by MI?
Reduced peripheral coronary artery due to atherosclerosis and inversion of an artery vein in both.
So reduced blood flow in coronary arteries. If it is maybe an atherosclerosis or a plaque deposition or thrombus, various things involved. Okay. Particularly in coronary artery. What is coronary artery? You all may know. It is an artery which gives blood supply to the heart. Yes, the artery which is present in our heart to give a blood supply to the heart. It is called as coronary arteries. Coronary veins also there. There are two types of coronary arteries: right coronary artery, left coronary artery. In that, left coronary artery is divided into two. Give a bifurcation. That is LCH and LAD. Okay. So if particularly any arteries have a blockage, either atherosclerosis like plaque formation or calcium deposition or calcium fat deposition or what thrombus. So it include the particular area perfusion, blood perfusion. Okay. So which leads to poor blood supply. So the particular area of LV damaged, affected. Initially, it is suffering. It is need some amount of oxygen. Initially, that time we have some deflection, which is called as elevation in ECG. And sometimes the cell sometimes not, and later the cell death will occur. So continuously, one area does not have proper or adequate blood supply or oxygen supply, leads to death of the alveolar cells. Here the myocardial cells, which leads to ST depression and also ST elevation. Okay. If any other arteries can have an occlusion, it leads to elevation, and other arteries which completely occluded and the particular area of myocardium get affected, the cells also get necrosis, which is depression, which is shown by depression in our ECG. There are various types of MI. Correct? What are the types of MI? Anterior wall MI, posterior wall MI, inferior, lateral wall MI. Okay, septal. So anterior wall MI, posterior wall MI, lateral, inferior, septal MI. Okay. So the lead placement also like anterior leads, posterior leads, inferior leads and lateral leads. Okay. So V1 and V2 are septal leads. Okay, and anterior and septal leads. V3 and V4 are okay. V5, V6 are lateral and also
inferior leads 2, 3 AVF.
Okay, lead 2, 3 AVF is inferior leads.
Lateral 1 AVF, V5, V6.
Lead 1 AVF, V5 and V6 is called as lateral leads. So if posterior deflection will be analyzed using V5 and V6. If any elevations in V5, V6 alone, and lead 1 and lead 3 may be deflection, depression is present there, will serve as what? Posterior wall. Maybe it is posterolateral or intrusive. That's like that. Okay. So here the anterior wall MI, among the anterior we also have anteroseptal, anterolateral, apical. Okay. Anteroseptal, anterolateral and apical. Initially there are apical MI, apical LV, which is blood supply given by LAD. Major loss, n number of branches are there. So blood supply given by LAD. There is any occlusions between the LAD which affect the apical blood flow supply, and also the apical contraction will get decreased. So the particular area of cells are get death, necrosis. So in presence of apical MI, LV contraction also moderately reduced. LV apical is a major thing, will give a major blood supply. Importantly, will give a large number of blood supply, right? Combined blood perfusion. Okay. If one segment get affected, the contraction also get affected, and our cardiac output get affected. Systolic volume, diastolic volume, ejection fraction, everything get affected completely. And anteroseptal, anterior and septal, that is V1, V2, V3, V4, lead 1. Lead 1 lead to have depression. V1, V2, V3, V4 have elevation. Anterolateral, V3, V4, V5, V6, anterolateral. See, anterior leads are V3 and V4 once again. Septal leads are V1 and V2. Inferior leads are lead 2, 3, AVF. Lateral leads are posterior leads are V9. But nowadays there is no posterior leads are placed in ECG. We are ending the leads with P6. If any need any pericardial effusions or posterior aspects are needed means V7, V8, V9 can be recommended. So here once an MI get known with the knowing ECG, next step is a patient is immediately subjected to emergency or catheterization or emergency procedure. Either they may feel pain, the eyes is object or penetrate or subjected, or else the patient is subjected to emergency for the procedure can be happened. Okay. So MA means elevation in a particular area. Which particular area? It is an anteroseptal or anterior lateral. Anterolateral means the leads, the placement are visible here. The area may be given results like elevation and reciprocal changes of opponent lead having depression. We can able to learn more about